like to invite in Elizabeth Wharton, and also welcome back Julie and Eric from earlier. And I also like to introduce Saif Abed, who we heard from earlier this morning. And now Dr. Saif is going to chair the next panel. So Saif, over to you, and welcome to Elizabeth and yourself. And thank you for a great talk this morning, great presentation. And I believe that the COFR approach is a great tool, but maybe you'll discuss that later on anyway. So thank you.
Well, thank you very much, Ian, and really apologies I couldn't join the session live this morning, but it's great to be here. I'm really happy to be able to chair this panel session. And so first of all, I'm mindful that I believe everyone has given a talk apart from Elizabeth. You'll be following up this session with a talk. But to spare everyone doing introductions, I think there's so much to discuss here. If everyone doesn't mind, I'm just going to dive straight into it, and I'm going to go with the elephant in the room when it comes to cybersecurity, but in particular IoT and OT, is regulation. It was great that we just had Kevin doing the last talk, because I think it's very timely. And I wanted to start with you, Elizabeth, actually, if you don't mind. It'd be great to hear have you seen any examples in other industries where regulation has actually come together in a timely fashion and made a difference to how that industry manages security and risk? And what do you think is key to making the same thing happen in healthcare?
Well, and thank you. And I appreciate everyone having a double dose of me back to back this morning. And spoiler alert, a lot because of the speed of the regulatory process, both US, abroad, everywhere, you're basically chasing after concepts. And so part of my background, and another spoiler alert, looking at the aviation industry, where you have industries where cybersecurity is an afterthought. Safety is obviously a main priority. And from a US context, you look at the FAA, whose mission is securing safety in the national airspace. But to then say, oh, and by the way, with the existing budget you have and the existing, all the different players, legacy systems, you now need to integrate cybersecurity into all of these things. And it's not just the avionics systems, it's all of those different pieces. So we're still playing catch up on a lot of those areas, and which is what's going to be interesting watching some of the other, with the healthcare, with the IoT. Can we address that? Or are we always going to be, from a regulatory standpoint, playing catch up if we're chasing specifics?
Yeah, that's a really good point. And actually, Julie, if you don't mind, I'd like to come to you on that point. The threats we face move at such a quick pace, always faster than the regulations that we can develop, faster than even the best practice we can develop. And I'm here in London looking at what are we doing globally to learn the lessons and move quickly. From your perspective and your activities, how can we accelerate best practice and regulation in the IoT space to make sure healthcare can look after itself, or at least become a bit more resilient?
Sure. So that is a heavy question. And I would say I'm going to answer it in two facets, one from a federal government lens, and then the other one from our public-private partnership that Eric and I co-lead. So on the federal government side, as Elizabeth just mentioned, we are chasing every regulation, every directive, every executive order that has come out in the recent months and in the recent years. However, if you look at those directives, orders, etc., most of those are, I would say, accelerating certain basic principles that we are doing today. And the reason why they are aggressive is it is now time-bound, for example, or there are certain compliance activities that federal government has to achieve and has to do. So to me, from a risk management lens, that is very beneficial in a way. However, to Elizabeth's point, a lot of the challenges that we have is on the budget side, the investments, the funding. And as all of us know, in terms of IoT, there are always going to be the next technology, the next emerging technology. And with that is going to have the associated emerging threats to those technologies. So once we put in place, for example, a tool or technology for encryption or multi-factor authentication, all of a sudden you have another set of maybe better or more suitable application, software, whatever, to address those vulnerabilities, to address those threats. So I would say we will always chase. However, the role of policy and the role of regulation will always be there to accelerate, to emphasize what is it that we need to do first, and what is it that is more critical than others, and helping us, not dictating the risk management activities, but it is helping us manage those risks and prioritizing it based on what we see within our environments. And if I may, I know Eric has a lot of thoughts on that on the public-private partnership side, but those are some initial thoughts based on your heavy question. It's very heavy.
Well, I'm here to bring the heavy questions, I'm afraid, but thank you so much. And I was going to come naturally to Eric, but I think Julie used you made a really important point about how we manage the risk, and coming to the point around budgetary management as well. So Eric, it's great to share the stage with you again, albeit virtually once more. It would be great to understand when we are engaging with other C-level executive management in a health system, whether here it's in the UK, Europe, Asia Pacific, or the US, wherever it may be, there's always the question of what's the compelling event that drives investment in a certain emerging risk area. And in this case, we're talking about IoT and OT, but unfortunately it applies to many things. So I'm curious, how compelling is a new regulation as a compelling event to drive change or action in your experience?
It depends on the regulation. It depends on the meat behind it. Yeah, I think compliance is definitely an avenue that you can take in order to get to a baseline, but I think a regulation doesn't get you to risk management. I think that's that the practice of risk management is actually, I think, far more impactful and meaningful than just trying to meet the letter of any particular law. So maybe I'll go off on a little bit of a tangent here. But one of the things, because you were talking about like how do you secure the funding and how do you manage to work for that. I like to talk about risk in healthcare in three facets. And if you can boil all your risk up into these three things, that's a beautiful construct, because the C-suite gets it, when you talk about it in this way. So the first risk is the one that we've all talked about for the last 25 years, which is privacy and confidentiality. There's nothing new there. IoT, medical technology, all that. We've got sensitive information on those devices. We care about that information. We got to secure that information. But the lens of protecting data is very different from the lens of protecting the clinical effectiveness of a device or the safety of a patient, and so forth. So the second risk I talk about, probably the most important risk, is the patient safety risk. And that's I talk about that in the context of yes, you could take a medical device, you can alter a device, you could potentially cause it to do something that it's not supposed to do. A couple of years ago we heard about the horror stories of the infusion pump, dosing 10 times the amount of dose that it's supposed to within a period of time, and oh my God, the sky's falling kind of thing, and bad, like scary, all of that. But has it happened? Don't know. Or, well, do we even have the reporting systems to know if it happened? That's a whole other question. But the real issue of what has actually happened is delay of care, because our ecosystems of care are down. And ecosystem of care is inclusive of the medical technology, of the OT, of the IT, and everything that we rely on as practitioners to work within the volumes and the scale that we work with now. It's all digitized, and so it has to be available. When you go to downtime procedures, you just can't have the same volume. And so that delay of care challenge is really important. And then I'll take that even a step further, which is don't think about just the spot issue of a delay of care of a particular system, hospital system, or what have you, but think about it as more of a public health issue, like of a regional challenge. Maybe there's an attack that brings down, a series of disparate hospital systems within a particular region or city. That has huge consequences. And I think, so really, really important. And that risk is one that the C-suite understands. The last risk is the financial assets risk, and that's just the managing the business. And again, it's not about necessarily confidentiality or privacy. It's about how to stop fraud and those kinds of things.
Perfect. I have some comments, but Kevin, do you want to come in on this? Please go ahead.
Yeah, sure. I just want to follow up on the comment about availability. One of the interesting things that happened this year is there was a medical device, a radiation cancer therapy device in April that went offline, but it went offline in a rather unique way. A piece of ransomware had broken into the manufacturer's facility, and because of the remediation process and basically the remediation playbook, that private cloud became unavailable. And normally this wouldn't be a problem, but the medical device depended upon that cloud in order to function. And so therapies could not be given. And that's something FDA considers to be patient harm when the therapy cannot be delivered for cancer radiation therapy. And that was out for weeks.
Yeah. And I just want to double down on what Kevin said, that specific case. Hopefully we all know what that was. It if anything, that illuminated the challenge of, from a hospital and practitioner perspective, we used to think about, well, third parties are supposed to have these business continuity, disaster recovery things in place, and it's their responsibility by contract and so forth. But when they're in the middle of critical processes, critical functions, mission critical care, and some of this mission critical care, like the radiation oncology and medical oncology treatments that Kevin was referring to there, I mean, these things you got a day maybe, based on how severe how severely sick some of these patients can be, and there's got to be alternatives. The cloud is not a panacea. It's great, but it doesn't solve all the problems. So we have to think about this from a business continuity perspective in order to maintain that resiliency.
And that's why I don't like to use probability to describe, like, well, what's the probability ransomware is going to take down? Well, it's 100%. So what you really need is, as you say, this plan, so that you have a backup plan, so that they don't simply become unavailable. But I think there's a huge tension between two completely valid approaches, the OT security approach and the IT security approach. They're often in alignment, but in this particular case, they are not. Because for IT systems, it makes sense. If you get hit by ransomware, you take the system down. But an OT system, no, you need availability. Availability is a key property you cannot lose for a life-sustaining device, for instance.
Well, so before I was a moderator, I was actually just going to be a panelist. So I'm going to remove moderator hat and appoint myself panelist for a moment. So, I'm a clinician by background before I sold my soul to go into the world of cybersecurity. And for me, it's always about shifting the conversation piece and making it cybersecurity, public health, national security, and really shifting it away from a technical conversation. And I think one of the big challenges is when we do segment IoT from OT, from IT, whereas everything is increasingly interconnected, increasingly interoperable. What's the role of the medical device and the EMR system? What's the role of one organization and its data sharing and its piping with the next organization along from it? And I think it's at that point where, that legacy router sitting in a cupboard somewhere that no one has looked at for a long time ends up being the second, third order reason why a series of critical IoMT devices are no longer accessible or functioning. And I think it's that level of scope and spread that makes it very complex to develop regulations, to develop clear plans of action. But it's great that we have the people on this call who are actually dealing with that, because I think it's enormously challenging. And I want to come to a point there. So, of course, my life's work so far has been about clinical risk quantification from cyber attacks and whatnot. So I'm curious, and I want to start back with you, Elizabeth. how do we realistically, and I think this is the key point, realistically model a clinical impact? Because it seems that every vendor under the sun, every security consultancy, I call a spade here, is talking about patient safety, but they don't always have a methodology that's specific to it. So how do we not create unnecessary fear that turns the people who we want engaged off, and actually present realistic things? You know, Eric mentioned, we all heard about the infusion pump. Haven't seen that many examples of it. So what's realistic, and how do we go about modeling it in your experience, Elizabeth?
Well, and one of the things I've worked with, so my background is working with security researchers and, you know, identifying all those threads that you don't know are there. So one of the best ways to identify the threats is to show, or in this case, to show the risk, to identify, well, what happens if you have to take it offline? If you know, what is the impact? And when you're talking to, I call it the C-suite, but putting some of that into perspective is like, well, one, we come to a grinding halt. Everything that we're doing, from the patients to the revenue streams, to the costs, the risks, and understanding that it may not be something that you have done. It may be something in your supply chain, and not meaning the actual, you know, oh, well, the medical supplies couldn't get there, or the records. Well, the cleaning company that was working at the hospital had a risk, and they had an issue, and it took them offline, which took this offline. So when you're looking at modeling, it's being able to describe the landscape and identify all the different pieces and the impact. If it halts all the research, if it sets it back, if it taints the data, so that you can't count on those results, that being able to look at that big picture, but also identifying all the different threads that play together that often get overlooked.
Yeah, that's a really interesting point. What is realistic, what isn't, what is overlooked, and what shouldn't be? I have a question I'm going to open it up for Kevin, Eric, and Julie. It's for all of you. You can determine who tackles it first. But you mentioned public-private partnerships. Kevin, you know, in your presentation, you mentioned SBOM, of course. I'm curious, to what extent do manufacturers, in your view, and the private sector fully appreciate the extent of risk that can be associated with their IoT and OT devices and platforms, if you will? Because it's one thing to want to be compliant, it's something else to understand the magnitude of what can happen when something goes wrong in the ecosystems you operate in. I'll open it up to the three of you. Whoever wants to tackle that question first, please be my guest.
I can give it a go if no one else wants to take it first.
You unmuted yourself first, Kevin. So I assume
that's what I
that's how it works. Okay. So I look at it through a slightly different lens. Rather than does a manufacturer get it or not, I recognize that manufacturers are organizations and they have people, and there are different people in every organization. And so I will find some manufacturers, there might be an individual who clearly understands all, you know, the threat modeling, the processes to go through, but there might be another division that's managed by a different group that has a radically different approach. And so I wouldn't sort of just give carte blanche to a manufacturer because one group is doing a great job and the other group might be asleep at the wheel. So I think it's a constant sort of education of the importance of cybersecurity, and also trying to educate. I understand a lot of folks don't have formal training in cybersecurity. They might have formal training in other things like medicine or manufacturing or safety. And so it's important to help educate them and speak their language, to explain why, for instance, probability works well for, you know, this medicine and, you know, Mother Nature, but it doesn't work for cybersecurity. And here's the science we use. It's about making sure that the stakeholders know it's not just about hackers and hoodies, but they're real adversaries out there. It's financially motivated, everybody wants to find the appropriate solution, and the hard part is finding the right one forward. But the good news is there are many different solutions, and FDA doesn't prescribe any one particular solution, but we certainly have our metrics.
I'll add to this a little bit, which is, this is an incredibly you have to tackle the topic as the complex ecosystem that it is. So it doesn't, there's not one single problem or one single issue that is the result of, that causes the result of all the security challenges. So I'll start off by saying 10 years ago, you know, medical device manufacturers and hospital delivery organizations were at ends with each other. Both sides thought it was the other person's problem, you know, and security is your responsibility, it's not ours, blah, 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 blah. You know, the hospitals would say, you're putting out weak devices, how could you, blah, 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 blah. You know, the reality is there's the MDMs, there's the OT folks, you know, your cameras and HVACs. And I think that is actually an interesting trajectory on its own right. The MDMs, certainly the large ones, have come off very far. And, you know, the Health Sector Coordinating Council, you know, did a joint partnership on the delivery of the Joint Security Plan, which is a product security framework on how to build new security baked into the devices. But then it's the HDO's responsibility to actually implement it and do it correctly. You know, so we've got our own accountability in there. And then you've got a third party in the mix, which is a lot of these devices are actually managed by other vendors. You know, so you've got the device, the product, some other party that's doing the management side of this, and then you've got the people using it. So that's a trifecta of challenge. And depending on who you're talking to, some of them do it incredibly well, but you have to, the whole, you know, when I look at this from a CISO's perspective, it's about visibility, it's about, you know, preventing what we can, and when we can't, knowing very quickly that there's an issue and we're responding to it. And so when you've got maybe it's a third-party vendor, not a medical device manufacturer, but when you got a vendor that's connecting into your environment and they're segmenting their stuff off, that's fine, that's good, right? Segmentation is a security control, we like that. But then it becomes a black box and everything is, you know, don't look over here, we've got it. And they don't necessarily implement the cyber practices, and you don't have a program that has a view into what's going on. That can become a huge problem because it's quite possible that there could be deficiencies, you know, associated to that, and that could be in a pathway into your environment. So, and I think of it just as like building management systems, you know, HVAC systems, and how important, Elizabeth, I'm going to go back to something you were talking about earlier, kind of, you know, touching on the third-party supply chain. Like if your PPE isn't coming in, or your cleaning supplies aren't coming in, then you can't, you know, run an OR, you know, and if you can't run an OR, you can't do certain things, you know, and so, and there could be digital implications associated to that. So the PPE company could get shut down because of a ransomware attack, but we're not thinking about it in that way. You know, we think, oh, PPE, that's physical. That has nothing to do with you know, this digital environment that we're in. So it's a huge ecosystem challenge and problem that we have to get our arms around.
Well, Eric and Elizabeth, you both opened it. Sorry, yeah, I'm going to come to you. I just want to augment the question slightly, Julie. I want to make it more difficult, in fact, for you, if you don't mind. Okay. I know, because you open the can of worms of supply chain security has been opened up in all of this, and IoT obviously expanding that equation. I'm curious, from a federal level, how do we look at supply chain security from an IoT perspective, you know, in terms of public health and safety and managing that risk? Again, another deep question, I suppose, but it just got more complex because of Eric and Elizabeth.
I know. So I think it's still relevant to your question about supply chain, because I wanted to pull the thread of what Kevin started off with in terms of it's just not one single domain or one single team. And then Eric mentioned that it's not only one single set of equipment or set of devices that you are looking at here, because I think one main concept that we need to make sure gets, I wouldn't say addressed, but gets advocated for is you have to know how to prioritize. And how do you know how to prioritize? And I liken it to the federal government's program for high value assets. So your critical systems, and you know that those are the ones that you need availability for, and in terms of a continuity perspective and what Kevin just mentioned, you know, you have to engage your whole healthcare organization and facility, because only clinicians would know these are the very specific assets I need to run if there is such a cyber attack that takes down all our systems. So to me, that's HVAs, that's critical systems, prioritize those, and you get some sort of, I think I saw a thread in the chat about how do you know how to mitigate or prioritize those risks? How do you know how to quantify or qualify which risks to do? So I think, and I go back to my initial panel and I'll stop there, is security and resilience has 4 pillars for critical infrastructure. That's government, industry, emergency management, and security. There's no way that emergency management and security are disparate, siloed, and if you go into the other domains of enterprise risk management, that's why we are really just going forward, kind of pounding this pavement of cyber and ERM. They have to go hand in hand. Kevin and Eric did a lot of good concrete examples of what that looks like.
I think it's an excellent point, especially about knowing what is important clinically. I mean, one of the points I always made was the arterial blood gas machine. When I was a junior doctor working in a big teaching hospital, you know, people think that's just kind of a random device out there, but that affected what we did in general surgery. It affected what we did in respiratory medicine. It affected what happened in the emergency room. And we only had a couple of them in the hospital, surprisingly, at that time. That, for whatever reason, becomes unavailable, whether it's a malfunction or a cyber attack, caused chaos in terms of workflow. So really having that understanding, I do think is important. I saw a bit of a debate happening in the chat that I want to bring to the group if we have time. A really quick anecdote, if I may. When the WannaCry attack happened, I got a call from a prominent journalist, and I thought I was going to be asked about mechanisms of attack. I got asked one question: who do we blame for this? Is it the Minister of Health's fault? And I remember, you know, I'm more of a diplomat now, but that was the beginnings of me trying to develop my diplomatic skills. I found a way to not blame anyone for it and focus on what lessons we learned. But in the chat, someone said, essentially, who should we hold accountable? Should the CISO be held accountable if the IoT estate leads to complete chaos in a healthcare organization? They mentioned a point about CISOs in smart cities. I'm curious, and this is, we'll go around the room, Elizabeth, Kevin, Eric, and back to you, Julie. Where does accountability come in on all of this in a meaningful way? Is there a way you can ever hold a group of people, a person, an organization accountable so that others understand how impactful something going wrong in our space is? And you know, if IoT is the example we want to use for that, I think that's timely. But Elizabeth, what do you think about accountability in all of this?
Well, and it becomes tricky. So I was with the city of Atlanta when we got hit by ransomware attack that shut down or crippled some of our critical systems. And it was easy to kind of point around the room saying, well, you didn't implement this control that you were supposed to, or you should have vetted this better. But at the end of the day, you have to look at what's the point of the blame. Is it to move the standards forward, the practices forward, or is it just someone to yell at, which as a lawyer, I frequently throw up my hand and say, yes, just yell at me, get it out of your system. I'm the bad guy. And now can we move forward? And so that's when it comes to it, looking at what was the harm. Was it a third-party vendor didn't do something? Was someone negligent? Or was it a comedy of errors that, okay, someone missed this, someone missed this, someone missed this? As long as you're identifying someone to move it forward, then that's a whole different kind of conversation than, oh no, you need to be financially responsible because you just ignored this and used a vendor that you were friends with. So.
Yeah, I think that theme is going to continue in some of the answers potentially. But Kevin, over to you. What do you think about the role of accountability or meaningful accountability in all of this?
Sure. So I just posted a little URL to an article I wrote about this subject before I joined the FDA. It was several years ago, about how to climb out of the ransomware mess. and it talks about, I would say, more on responsibility than accountability. But this is a challenging problem. Let me just get to the responsibility part. The challenge with cybersecurity is it always falls between the interface of responsibility and accountability, because all cybersecurity problems, virtually all cybersecurity problems, are these corner cases of, well, who's responsible for that? And so security researchers and those looking for problems love the uncertainty of where it's not clear who's accountable or it's not clear who's responsible. And unfortunately, I think it's always going to be the case that there's going to be a shared responsibility, but it needs to be I don't think we've yet reached diminishing returns on defining sort of the shades of gray of which parts are different people responsible for. We're never going to be able to say any one stakeholder is completely out of the picture for responsibility and accountability. There's always going to be elements for the manufacturers, the health delivery organizations. Patients play a key role in protecting their own security and privacy. Regulators, physician groups, security researchers. There are just so many different groups that have a hand in responsibility for security and privacy. I think one of the more productive ways forward is to think about, okay, there are a lot of problems. How can we design this out? And I think a lot of it begins with just sort of the bread and butter, the basics of, well, we're never going to get out of this mess until we have good threat modeling. And we're eventually going to have to phase out all the legacy stuff. And don't forget, every time we put a new product out there, that's just new legacy. And so your approach can't be to buy your way out of the problem. The approach needs to be more like managing a disease, hopefully not terminal. But you're managing this cybersecurity disease. You're always going to have to be managing it, and you want to make sort of wise choices along the way. So there's not going to be any one, I think, individual organization accountable, but we do, I think, need to have more clearer defined roles of accountability and responsibility.
Eric, what do you think about how accountability works in this whole conundrum?
I think you should hold the criminals accountable. Let's not forget why we're in this mess, is because there's crime. And the other thing that we have a shortage in cyber talent. So this concept of, and I'm not saying this because I'm a CISO and I'm trying to absolve myself of responsibility. I'm probably one of the most grabbing of responsibility people that you'll meet. But we have a massive shortage in cyber, a massive shortage in engineering, analysts, talent, leadership talent, CISO talent. And when you talk about healthcare in particular, we've got a huge talent gap, from a leadership perspective. So if you start now saying the CISO is going to be personally responsible for a break-in into a hospital organization, you're not going to see CISOs. That's not going to happen. And it to me, honestly, that question is just, who's the scapegoat in all of this? Now, mind you, we get it. Like you get into a position like this. That's the risk that you run. You sign up for the job. You sign up for for what that means, and you take the bumps and the hits and the bruises. But if we're going to really truly solve this problem, you can't hold it on one person, especially the person that doesn't necessarily even have the operational decision making for where some of these issues align. So I personally think there is absolutely responsibility on the CISO side. We should be and accountability. I mean, there are standards that we should be setting. There are policies. There are risks that we should be managing. There's a maturity of a program that we should be demonstrating, and there's a due diligence that must be done. That's our job. We have to be advising on risks. We have to be driving maturity. We have to be pushing constantly. We got to be showing that we are doing the absolute best that we can do. And then, but if we're going to get cyber baked into the organization and have people truly understand what it means to protect the organization, you got to have these other players in the mix. The clinical engineering, medical technology folks, they've got to be held accountable for how those devices are actually managed pursuant to the standards that are set by the CISO. So it's a complicated mix. But I'll tell you, I'm going to go back to what I said at the beginning. If an organization is doing the right thing, blaming the organization when they get hit by a cyber attack, we all know it's impossible to stop, right? I think that's a fair thing to say. It's good luck stopping crime, right? We haven't done it throughout the course of human history. So if we put that as the expectation with cyber attacks, is that we're going to stop all the crime, it's just not going to happen. But how we respond to it, that's the key. You know, how quickly we get in there, how quickly we nullify, how quickly we get and we demonstrate that we have the deflection capabilities. You know, this is honestly where our federal government can help, especially in the ransomware crime syndicates that are out there, is put the pressure back on these governments that allow it to happen within the borders of their country, as long as, you know, these same ransomwares don't attack the country that they're being housed within. I mean, that's this big challenge that's happening. So anyways, that's my soapbox.
Well, you're entering my geopolitical world, which I'm not going to get into in the last 3 minutes. But Julie, what do you think about accountability and how it needs to work? And I suppose building a little bit on what Eric said, I suppose if you're comfortable with it, about how this works on a global scale in about 1 minute.
Sure. So I don't have much more to add in terms of what others have already said, because again, you're always going to hear it's all about taking all these risks and opportunities as an organization at the enterprise level. Because if you don't do that, there will be missteps or maybe loopholes and gaps, and you will find yourselves trying to look for where did we miss that one thing. However, what I've seen with those that are more mature with first of all, their enterprise risk management processes, they have an idea of where these responsibilities or accountabilities lie. And I'm always going to come from a risk management lens first. And then I am a policy geek, so I will go into that policy lens also, where you have to have your policies in place. And you have to have those things that are very clear, where these are the things we need for contract language, for example, to hold our vendors and third-party providers accountable for certain things. And I will emphasize, last thing is what Eric just mentioned about due diligence. That is hard to quantify, it's hard to make concrete, but there are certain things where you can really say, yes, I did these things, but it still happened. That is what risk is. And that is what risk management is. You're not eliminating every single thing, but you've already shown that I am doing these steps to make sure that this doesn't happen again, or to make sure that my bad practices aren't permeating throughout my organization.
I think that's a really great perspective, actually. And I want to share a quick perspective from myself and ask a final question to wrap things up. I've been given a little bit more time, just a little bit. I think, Eric, I want to build on something you said. In my view, it's not the risk of the breach of the ransomware attack happening that I think is the metric that I'm most interested in measuring success on. It's what impact was felt. So I actually think one of the most important relationships is the relationship between the CISO and the chief medical information officer and the chief nursing informatics officer. Because ultimately, yes, if the ransomware attack happens, but we have a tried and tested plan for what the clinicians will do in practice when everything goes offline, so that the end recipient of care does not feel a huge delta in the quality and safety level of their care, then actually we've succeeded, in my view, in that perspective, even though the attack happened. And I think there's an element of education that we as an industry need to provide all the different leadership functions about what success looks like, so we don't end up, as you say, scapegoating. My last question will be just a really simple one. If the people who leave today's conference, if they have to take away one lesson from each of you, whether it's a talk you've done or Elizabeth, a talk that's upcoming, what is the key thing you want the people watching around the world to take away with them from each of your particular talks? Elizabeth, if I could start with you, and then Kevin, Eric, and then Julie, and then we'll wrap up. Go ahead.
Yeah, and basically look for the power of the purse. Look for where the funding is coming from, what's going to be, what's the biggest dollar impact, because I think that's going to drive both regulatory policy as well as contracting, and basically be the shift the stick that goes also with the carrot.
Great. Kevin, over to you.
Sure. I think the important thing is to bring more science into cybersecurity, because that's the way to get more assurance. And the opposite of that would be using probability. So be very careful of the trap of using probability. Again, radiation therapy system went down. They had 5 nines of reliability. That's under 2 minutes of downtime a year, guaranteed. It was down for 4 weeks. Don't use probability for a cybersecurity argument.
I just want to say that's such a great point. Just speaking, that scientific perspective is so important with that. Eric, over to you.
Yeah, so I will say, when for the CISOs or the practitioners in the audience, when you're trying to boil up and manage this complex, topic, try to be simple about it. Present a risk, grade that risk, and then present side by side your plan of action and your performance to that plan of action, and show if you're working the risk, you're in the green and you're good. If you're not working the risk, that's when things go off the rails. And I think that's a very simple tool to try to describe, how things are happening and how to, really get your organization behind you to keep things moving and keep progressing, because it's ever evolving, it's ever living, it never stops.
Right. And Julie, the last word is for you. Please go ahead.
Sure. So last words, cybersecurity and enterprise risk management. That's everything that we've mentioned today. And just for Cybersecurity Awareness Month, that was just last month, continue educating yourselves and know what your role is. I think that is key, especially for the healthcare and public health sector. We have a vast variety of professionals, ranging from clinicians, researchers, academia, federal government, vendors, and of course, your IT and information security professionals. So maintain your engagement and your education and manage the risk.
Brilliant. This has been such a great session. It's great to have people from, such great functions of the cybersecurity ecosystem coming together.